If you or somebody you know has hypermobile Ehlers-Danlos Syndrome, this video is for you. So for some reason, I see a lot of patients in my practice, young, otherwise healthy patients who have been diagnosed with this condition. Ehlers-Danlos Syndrome is a connective tissue disorder, and there are various subtypes, but the most common subtype is called hypermobile Ehlers-Danlos, and it mainly gives patients chronic pain, even chronic fatigue, hypermobile joints obviously, and lots of other more vague symptoms such as neuropsychiatric disorders, autonomic problems, gastric emptying problems, for example, and dysautonomia as well in some cases. Most of my patients who have eventually been diagnosed with this disorder had to go through a whole diagnostic odyssey, because the problem is right now we don't have a gene that we know of for this disorder, and we don't have a blood test, and so therefore the diagnosis is clinical, and it can be a little bit of a gray picture, and many of my patients who've had this have been told for many years that it's all in their head, or that they're imagining these symptoms when they know that that is not the case. So a very exciting new study just came out in September 2025, basically trying to find a gene or a part of a gene responsible for this very poorly understood disease. So what they did was they took 1,800 cases, over 1,800 cases of Ehlers-Danlos, and matched them with what we call controls, so patients that are similar ethnicities, and looked at the genes and tried to see, is there any particular gene or locus on a gene that is associated with Ehlers-Danlos syndrome. And the cool thing is they found not one but two. So one of these parts of a gene is associated with nerve function and pain signaling, and another part of a gene is associated with zinc and connective tissue formation. So this is really exciting, because for the first time we have genes associated with hypermobile Ehlers-Danlos, so we know for a fact now that it's certainly not all in your head. So the first really exciting thing about this study is, of course, that hopefully in the near future we will have a test, and therefore patients can be diagnosed sooner and get help sooner for this condition, and not be told that they're imagining it, like many patients are for a long time, unfortunately. And of course the second part of this is, with this better understanding of the disease, we can hopefully find some effective targeted treatments. Hypermobile Ehlers-Danlos is often associated with other conditions such as fibromyalgia or ME. And another really cool aspect of this study was they looked and found that there were associations with those conditions and these genes as well. So the future for folks who are long suffering with these conditions is bright, and hopefully just around the corner we'll have a much better understanding, and folks won't have to suffer on like they have in the past.